Hey everybody, it's Chris, and I've got another interview for you today with Dr. Lucas Timms. Dr. Timms is a fellow of the American Board of Naturopathic Oncology. He spent 8 years at Cancer Treatment Centers of America, focusing on all areas of patient care as well as clinical research. He served as the medical director of integrative oncology at Western Regional Medical Center. In 2018, he left Cancer Treatment Centers of America and joined the Reardon Clinic in Kansas City. In addition to patient care, Dr. Timms enjoys doing research, teaching, and writing for medical journals. He's a longstanding member of both the Oncology Association of Naturopathic Physicians and the Society for Integrative Oncology. So he knows a lot about integrative cancer treatments and naturopathic oncology. So targeting cancer cells with natural compounds. So I'm looking forward to this interview. I'm a fan of the Reardon Clinic anyway. Some of you who've been following me for years might remember my interview that I did with Dr. Ron Hunning-Hockey, who is the medical director of the Reardon Center in Wichita. And so I had a great chat with Dr. Timms recently and thought it would be a really fun interview, very informative, and especially if you're wanting to understand integrative cancer treatments, what options you have, what else is out there besides conventional standard of care, and that can be used in conjunction with standard of care if you choose. So, Dr. Timms, thanks for taking the time to talk.
Thank you, Chris, for having me. Excited to be here.
Good. Well, how did you get involved? I mean, how did you discover naturopathy, right?
Yeah.
Naturopathic medicine.
Yeah, I think it was a bit of a winding road, if you will. Was always kind of interested in medicine and science. I grew up in Arkansas, as you said, and came from a family that was very into natural health and nutrition. My parents were kind of, those crunchy hippie type people that were very into like the macrobiotic movement of the 70s. And
nice.
So I kind of came out of that, and I kind of had that as a foundation. And when I looked at going to medical schools, I looked at all the different types of programs, MD, DO, and stumbled upon, even at that time, which was early 2000s, it wasn't easy to find information on naturopathic medical schools. And so but I did stumble upon it and went out and visited some of the universities, and it kind of really it was like a switch went off when I realized that naturopathy was much more about how do we blend, modern science with kind of ancient wisdom and healing and natural medicine. It wasn't just all or none. And that's really what I became interested in, and went through my training there in Arizona at Southwest College. And now, I'm seeing that play out in my career, and really feel like that foundation of naturopathy, I've been able to parlay that with my experience in a hospital-based system like CTCA and some of the other experience I've been able to get in my first 10 years of practice that have helped me even bridge that gap even more, particularly when it comes to integrative oncology, to really understand both sides of the fence. Because as I tell my patients all the time, I really do think with cancer care, your best option is the best of both worlds.
You spent 8 years at Cancer Treatment Centers of America. I'd love for you to talk about what you saw happening there, and not that what they're doing is different than any other clinic, but being in the eye of the storm, so to speak, and the sort of the good, the bad, and the ugly of conventional cancer treatment. Would you mind talking about some of those things? Because I know there are people watching that have never gone through cancer, or maybe they may be about to undergo treatment, or They just want to understand it. So talk about that.
Yeah, I think, first of all, I think Cancer Treatment Centers of America is a great place. And I think that the culture and the model when it comes to a total cancer center, as far as like, these big places like MD Anderson and Memorial Sloan Kettering, a place where you go just for all the components of cancer care. I think that the model that CTCA stands for is awesome. And I hope that we eventually get to where that's the mainstream. The problem was in the tenure I was there, is that sort of the pillars and the pieces of that culture and that model began to slowly erode. And some of that was due to the changes in the healthcare landscape, in the health insurance landscape. Obviously, in the 2012 to 2015 time period, there was Obamacare kind of settled in, and that changed a lot of reimbursement issues. And so,
will you talk about specifics? Like, what was their vision and their model, sort of in the early days?
Right.
And then how did that change?
Well, when I first got to CTCA in 2010, there was a lot of course, they do all the conventional treatments, surgery, radiation, chemo, but there was just as big a piece of that model was the so-called integrative or supportive services: nutrition, naturopathic medicine, chiropractic, massage, spiritual, mental, emotional support. I mean, really rounding out that whole kind of holistic cancer approach. And that was like, I was all in. I loved that. That's what I believe is the real, true, best answer for cancer, is to bring all that together. Because of financially back then, I think they were able to justify having all these services on board because these aren't things that patients were paying for. So it was kind of, hey, we're making enough money doing all the conventional therapies and approaches that we can differentiate ourselves by having all these other supportive integrative services on board. Like
what?
Like naturopathic medicine and nutrition and all those things that I just went through. So I would say that amongst the naturopathic medicine umbrella, there wasn't as many therapies offered as most naturopathic clinics that are geared towards cancer care typically offer. Things like IV vitamin C, mistletoe therapy, more direct anti-cancer type therapies, as opposed to things that help mitigate side effects and so forth. So even then, I feel like it was a little bit more watered down as far as the integrative services go, but it was still nice because there was an emphasis there. There was this emphasis on kind of this holistic approach.
Yeah.
But like I said, as time went on and things changed and reimbursement went down, all of a sudden you started seeing all these services drop off and lots of layoffs, and the model started shrinking back closer to what you see at an MD Anderson or a Memorial Sloan Kettering, where, all that stuff's there, but it's kind of like an afterthought.
Well, I talk about this in my book. There were some significant changes that were made to oncology billing with regulations, and basically the federal government realized that at one time, private practice oncologists were making up to 2/3 of their income from the profit off of chemotherapy drugs. And, large institutions were also making large profits off of chemotherapy drugs. Well, there was a conflict of interest financially. And a lot of folks don't realize this, but the cancer industry is the only segment of the medical industry where doctors are making a profit off of the drugs they prescribe. If you go to your primary care physician and they prescribe antibiotics, they don't get cut of that. They make no money from the antibiotic. You go to Walgreens, you buy it, Walgreens makes a little profit, that's it. So, of course, the drug companies are whining and dining the doctors and constantly, delivering meals to their offices and, doing all these sort of indirect compensation, right, to get them to prescribe drugs. But the point is, but in the cancer industry, the chemo drugs are marked up by the clinic and there's a big profit. But these regulations were passed which sort of clamp down on the profitability of chemo drugs. And so I think that's what you're referring to, right? So all of a sudden with CTCA and all these other places, their margins got kind of squashed. And then that hurt their bottom line and their ability to offer a lot of the integrative services they were offering, right?
Yeah, exactly. Correct. At the end of the day, CTCA and a lot of these big cancer centers are for-profit organizations. And they're answering to shareholders, and they have boards of directors, and all that other stuff's nice. But at the end of the day, if they're not making money, it's not justifiable for them.
Yeah, and obviously everybody's got to make money. No one should work for free. Sure. But there is definitely a problem when an organization gets so big, right? It just becomes this giant alligator that eats money, and you have to keep feeding the beast. And and now I think that's when patient care really suffers, when you've got all these people in positions of management and whatever that are trying to increase the bottom line, and all they're thinking about is the dollars, and the doctors are thinking about the patients, but the doctors are sort of answering to the administrators who are just thinking about the bottom line. And that's where medical care really starts to break down in terms of the quality that patients get.
Yeah, we got to the point shortly before I left CTCA where it seemed like there was just as many administrators as there were as people actually delivering care. And so just that balance alone kind of tells you where the shift of the focus goes.
Got bloated. My criticism of CTCA over the years has, and I don't want this to turn into a CTCA bash session, but it's just, from my perspective and also the feedback that I've heard from a lot of patients, and I'm asked about that organization often, is that they tend to sort of use the complementary and alternative as a bait to get people in the door, right? They use it in advertisements and things, and people think, oh, they do alternative therapies there and complementary and natural medicine, and and they get in the door, and then they say, well, yeah, we do those things, but you're going to need chemo, and that is the reality. That's what happens every time, pretty much. Well, so, okay, but moving on. So obviously things changed. It started off pretty good, and over time you decided to leave, and now you're at Riordan, and you're doing different things.
Sure.
At Riordan. Yeah. So I'd love for you to talk about the types of therapies that you are doing, and why you're doing them, and how you're seeing them help people.
Yeah, and just to back up a quick second, I do want to say that I think CTCA is world-class when it comes to diagnostics and world-class when it comes to coordinating care. They're really good at the conventional stuff too. Let's not leave that out of it. Okay. And so, again, I didn't want it to turn into a let's bash CTCA kind of interview, but I was honest with the upfront stuff, and I want to be also honest about, look, they do deliver really good care still. And I still send patients there, and I still have a great relationship with a lot of the doctors that work there. So just want to say that. But as far as my transition to Riordan Clinic, I just couldn't really ask for a better sort of second chapter to my career so far. Of course, having interviewed Dr. Ron Honeyhockey before, just a world-class institution. Riordan Clinic's been around for since the 70s, when Dr. Hugh Riordan started this clinic, sort of a godfather of orthomolecular medicine, and most notably his research on IV vitamin C. So I've learned a lot. I've brought a lot of my expertise that I learned in the hospital setting here, which I think they were lacking a little bit of that as well. So I think it's been a really good relationship where Dr. Ron and some of the other people that have been here doing their thing have helped me move myself forward, and I've helped them sort of see how we can continue to bridge these gaps that patients are finding when they are diagnosed with cancer, because there's so much information out there, and it's, do I do conventional medicine? Do I just do alternative medicine? How do I bridge the two together? IV vitamin C is really, I think, just a great sort of entree for patients to really discover the power of how you can synergistically use both sides of the cancer model. Because IV vitamin C is not something that you get from, an herbalist or a nutritionist or someone who, you have to have medical training to do IV vitamin C, okay? And so it's a way in which we know we can utilize this highly active compound that can help cancer patients not only with their side effects, but also to fight their cancer. And oh, by the way, it's very, very safe. So I think IV vitamin C is one of those therapies that you can always, outside of a few types of chemotherapies or a few issues with kidney function, you can always make a case that you're bettering a cancer patient's overall state with giving them IV vitamin C.
Explain why. What is it doing in the body that's beneficial?
Well, we're still actually learning new mechanisms of action from IV vitamin C. It's great. It's, the old kind of justification from a mechanistic standpoint was that if you reach a certain millimolar concentration of vitamin C in the blood, which you can only do intravenously, you can't do orally, then you get this rapid generation of hydrogen peroxide in the bloodstream, which again acts almost like a selective chemotherapy towards cancer cells because they lack the enzyme catalase that breaks it down. Whereas our healthy cells, the hydrogen peroxide, even in a large amount, doesn't bother them because they have the enzyme and the machinery to kind of deal with it. So that's kind of was the first reason why IVC was advocated for by Linus Pauling and Ewan Cameron and all these kind of forefathers of it, and even Dr. Hugh Reardon. But what we've also learned with continued research, some of which the Reardon Clinic has contributed to, is that there's even further benefit where we're blocking angiogenesis. You might have heard that term before, where cancer cells are able to put out signals to develop new blood vessels, which of course allows them to grow and continue to get stronger and larger. That's a mechanism by which IV vitamin C has been shown to work. We know that decreasing inflammation in the body is also another mechanism by which IV vitamin C works. And then one of the really cool mechanisms that we've learned is that you and your audience are probably aware that we've got different types of cancer cells. We've got sort of cancer stem cells, and we've got more like the offspring cells, right? And we know that chemotherapy's great at sort of mopping up the offspring cells because they're usually only being driven by a certain mutation. The cancer stem cells are where chemotherapy tends to fall short, and this is why a lot of advanced stage cancer tends to recur. If you don't get those cancer stem cells addressed, either through a surgery or through other therapies, they tend to become resistant and resilient and come back. And oh, by the way, they've mutated and they no longer respond to the treatment you hit them with the first time. So IV vitamin C, some researchers in Japan found out that some of the DNA mutations that allow these stem cells to become cancerous, we don't necessarily have to kill these cells. We can actually rehabilitate them. We can actually help them to become healthy adult cells again, which is really kind of shifts the whole frame of how we look at cancer, I think.
Yeah, reverting them back to a normal cell.
at one point, these were your normal healthy cells. They went awry. They went rogue at some point because of too much oxidative stress, too much toxin buildup, too many DNA mutations, too much mitochondrial dysfunction. And they found the only way they can survive is by converting their machinery to this cancerous state. So it's kind of like, the bad teenager that ran away and joined the cult, right? It's like, we want to bring them back. We want to try to bring them back, rehab them, and turn them into healthy adults again. So this research out of Japan tells us that we can actually influence and impact these underlying DNA mutations to rehab these cancer stem cells.
Yeah, it's almost so. It's something that I encourage cancer patients to do that sounds very woo-woo, but is talking to your body. And so this kind of goes along those lines of, if you're talking to your body and talking to your organs and talking to cancer cells, the cancer cells, and just telling them to be well, right? Like, be well. I love you. You're my cells. You're part of me. Like, be well. So it's like you're talking them back, back off a cliff, right? Like,
right.
Come out of the cult.
Exactly.
Yeah.
Exactly. And so I love kind of helping patients make that connection too. And I think that also helps them with the mental emotional aspect of things, because it's not always a war, it's not always, hey, we got to come out guns blazing and kill everything. There's a rehabilitation process to it as well.
Well, I completely agree. And I've never liked the battle and war and fight analogies are, useful, but
sure.
I've never liked them because, these are your cells. It's your body. It's your DNA. You can't really fight yourself. That doesn't make sense. The goal is to heal it. It's not really to kill it. Cells die. That's part of life. That's normal. But it's not about fighting yourself. It's about healing yourself. And so I appreciate you bringing that up. And I know there's ongoing vitamin C studies at several universities and all over the world.
Just some really exciting stuff going on.
What's some of the latest things that you've seen and learned about it that are that you're most excited about?
Well, not far north of us here in Kansas City, the University of Iowa is really kind of taken up the reins as a leader with IV vitamin C research. University of Kansas was doing a lot of that until recently, and the University of Iowa picked up some of the grants that they had in the pipeline and have kind of taken that and ran with it. Cornell University is actually doing some interesting research with colon cancer and specific mutations, combining IV vitamin C with other sort of novel compounds, chemotherapy agents. And again, I think that just speaks to more of this synergy that we need to have. I tell patients that IV vitamin C alone is not enough. It's not going to
it's not a standalone cancer cure.
It's not a standalone. It's an adjunctive treatment, and it's best used alongside other therapies, whether those are conventional or other maybe more integrative therapies.
Well, for those that don't know my story, I had IV vitamin C treatments. I lost count, but yes, numerous.
They add up.
IVs, yes, they add up. And again, it was just. That was really the only integrative treatment that I had that was available to me. I took a lot of nutraceuticals and herbal therapies and different things, but in terms of when I say integrative, like actually an IV type therapy in a medical doctor's office, that was the only one that I did. And like I said, had access to in Memphis, Tennessee. I can't say that it cured me. I can't even say that it helped me, but the research if you look at the research, I'm sure it did. The other thing that I'd like to throw in there about vitamin C is if you're going through chemotherapy creates, catastrophic levels of oxidative stress and free radicals. The point of chemo is oxidative damage. That's most chemo drugs. That's how they kill cancer cells and harm healthy cells. It's through oxidative damage. And so your body is trying to fight the oxidative damage. Right? Every day your body is trying to cool down inflammation and protect itself, and it uses antioxidants. Everybody's heard of those. Antioxidants neutralize free radicals, which are oxidants. So I'm saying all that because a lot of advanced cancer patients or patients that have been through a lot of chemo basically have scurvy. Their vitamin C is depleted to almost zero, right? They're just because their body has been using it up, trying to fight all the oxidative damage, right?
Yeah, and we're not. We've lost our ability to make our own.
Right. You got to get it from food, and the little tiny bit that your typical cancer patient is getting from food, if they're eating the standard American diet. I mean, it's used up like that.
Not getting any.
Right. I mean, it's literally just. It's not enough to help them, and so then they end up deficient, and literally they have all the symptoms of scurvy. They probably have scurvy, but it's so easy to turn around with vitamin C, and then the high dose and IV. To me, that's this other really important benefit, is that it's just helping the body recover from the damage of chemo. But it also, like you said, there's some synergy there where it's not like it makes the chemo ineffective.
No, I try to tell patients that, you've got sort of two things going on with cancer. You do have, even though it's all inside the same body, but you've got the cancer, then you've also got the human that has the cancer. And the nice thing about vitamin C is it does things to kind of bring the cancer down, but it also at the same time strengthens the human that has the cancer. And so whether that's, strengthening the immune system or repleting needed nutrients and resources like antioxidants, or decreasing the inflammation and the other burden of what's going on. Because while I do see cancer patients where they're completely healthy otherwise, usually there's other things going on in the body as well. And whether it's, they've got a chronic infection, or they've got, SNPs that aren't allowing their body to detox well, or they've got an autoimmune condition. The nice thing about the IV vitamin C is it's a little more agnostic when it comes to the ways. Yes, it has specific mechanisms that it helps to block cancer cell growth and rehab those cancer stem cells, but it's almost like an extinguisher for any sort of fire in the body too.
That's awesome. You mentioned SNPs, and so that makes me want to ask you, I'm assuming that you are doing DNA testing on patients to figure out where they have mutations, deficiencies, individualized issues that need to be addressed.
Yeah, 100%. I think a lot of the talk around genomics and genetics with cancer, at least on the conventional side, is more about like what are the genetics and genomics of the tumor, which is almost a completely different cell line at this point. But
because they're trying to figure out how we can exploit this.
Trying to find a druggable target. Exactly. Yeah. Mm-hmm. So, and that works when you've got kind of those offspring cells that are being driven maybe by one mutation. But we're trying to get more to the root of why did these cancerous stem cells, the original problem, what caused that? Yeah. So the genetics and the genomics and the epigenetics of each patient, that's that kind of, breadcrumb trail that helps us understand, why did you get cancer in the first place? And was it a problem with detox pathways? Do you have a malfunctioning P53 gene? Is your MTHFR involved? Most people's is to some extent. We see that a little more closely with some types of cancer, particularly breast and ovarian. But and then, just as importantly, how do we mitigate that? How do we support? Because everybody has SNPs. Just through the process of evolution and our bodies being exposed to the environment, you're going to have mutations. Those mutations aren't always set in stone. We can't influence our genes and our genome through our diet and our lifestyle and our environment. But people need someone to do that, to help them walk through that and figure out how to do it in a real strategic way.
Yeah, I think it's so important it's kind of like you need to know what your problem is.
Right.
If you don't know what your problem is, you can't solve it. Like there's no way to know. And I love the genetic research component because it really, everybody wants to know why they got cancer, and there are reasons, there are explanations. We know generally almost every cancer causer on Earth. I talk about most of them in my book, but we know what's causing cancer, but on a unique, specific person-to-person level, that's where genetics can come in and even paint a more detailed picture. And so that what you mentioned before, detoxification pathways, MTHFR, there was a third one you mentioned, P53. Are those the most common that you see? Are there any others that are, common, for lack of a better word?
Those are the most common. I mean, there's some more on the genetic side, like, of course, the BRCA gene and things like that play in. But I would say as far as things that I'm looking at more as, hey, how do we influence this with our diet, our lifestyle strategies, our supplements, our therapies? Those are probably the top three. But, I really, honestly, Chris, I think we're just scratching the surface with that.
I know it. I'm excited about the future, future epigenetic research and just, sort of unlocking the mysteries of the human genome.
But, these aren't conversations that are happening in an oncology office.
No. And the tragedy is that most patients say, why did I get cancer? And the doc says, well, it's probably just bad luck, or it might be genetic. But that's as far as it goes, right? Like, we did the test, you have the BRCA gene. Okay. Yeah. And it turns them into a powerless victim, right? They become a victim. It's nothing you did. It's not your fault. And you have no power to help yourself. You just need to show up for treatment and cross your fingers and say your prayers.
That's it.
And this is why I love what you're doing and other integrative, holistic minded doctors, because you're looking at the big picture, the whole person, and trying to, peel back the layers and get to the root causes of their diseased body, their sick body. If someone has MTHFR,
I make it a point to ask all my patients, why do you think you got cancer? And the look on their face is 9 times out of 10, it's like they got hit with a stun gun. No one's ever asked them that. They may have thought about it, but they not in a setting with a doctor. And you'll be interested. I mean, it's very interesting to hear some of the responses.
Well, I know stress is a common response.
Stress comes up a ton. Of course, a lot of talk with diet. But sometimes there's more talk about emotional toxicities and, loss of loved ones and grievings and things that weren't worked through on that side of things as well. And so there's even literature on this where, high probability of within 18 months of a cancer diagnosis that there was some sort of emotional or physical trauma to people. And so that's part of my initial interview with my patients, is trying to understand that piece of it too.
I call it the cancer trigger. It's that traumatic event, loss of a loved one, a death or a breakup, or even losing a job, losing a business, losing a home. It could even be death of a pet. As trivial as that sounds, it can be really, really traumatic for folks. So I'd like to ask you, this is really getting kind of granular, but if someone has an MTHFR mutation, how do you address that? What's your recommendation for them?
Well, they need methylation support. That's our methylation cycle.
What does that look like?
So there's dietary approaches, obviously, eating more green leafy vegetables, which usually that's, kind of one of the things you're getting them to do anyways, but you overemphasize that, right? Because you're like, hey, you got this MTHFR gene, you really need to be pushing the green leafy vegetables.
Lots of folate.
Lots of yeah, exactly. And then, there's specific products that we use that have kind of a nice blend of all the methyl factors, whether it's B vitamins, trimethylglycine, CoQ10, all those types of things that can help with methylation support, SAMe. So yeah, it kind of gives us a little bit of a blueprint there. And then we also know that, it's not something that's set in stone, like I said earlier. I've seen MTHFRs completely switch when patients start to adapt or adopt some of these diet and lifestyle changes and nutrients that their body's lacking. Their enzyme activity can change. I've seen it change 40% within a 6-month period. So that's another great illustration of, these things are not set in stone.
Yeah, that's fantastic. So can we talk about some of the other therapies you do, like mistletoe, things like that?
Sure. Yeah, mistletoes, I've had kind of a love affair with mistletoe. No pun intended. I know most people hear mistletoe and think about the ceremonial plant that we, the kissing plant. But mistletoe, I came across this probably 6-7 years ago, and through a patient encounter, basically a advanced stage pancreatic cancer patient that was doing really well. And through the history taken, I think the mistletoe is really what kept him going. But traveled to Germany, which is kind of where the mistletoe started, and learned from some of the clinics over there, and have been doing it ever since. And kind of like vitamin C, I think you could always make a case for using mistletoe with active cancer. It's truly an immune therapy. There's lots of these immunotherapy drugs that are out now, but mistletoe is kind of the old school immune therapy. And it just increases the immune system's capacity to deal with cancer on its own. And it does that through increasing, of course, specific types of white blood cells, inducing fevers. But that's oftentimes, for some people, their biggest challenge, not only during treatment, but long-term, is how do I get my immune system back on board? Because either that was the original problem with why they got cancer, or as a byproduct of going through chemo and radiation, now they're left with an immune system that's suppressed.
Yeah, I think it's both, because I feel like your immune system a person's immune system is really the difference between tumors and no tumors. Like it's
Exactly.
Your immune system, and there's a lot of things that suppress your immune system. It's toxicity, like you said. There can be genetic issues. There can be stress is a major immunosuppressant. Pharmaceuticals, tons of people are taking multiple pharmaceutical drugs prescribed by their doctors for other chronic conditions, and those drugs are immunosuppressant. And probably one of the biggest and least understood contributors to cancer is obesity. When I say least understood, I mean least understood by the public. Obesity is the second leading cause of cancer behind smoking. And this recent revelation that really blew my mind, I think this research came out last year, was that when a person is obese, their immune cells are also obese. The immune cells take up those excess fatty acids and become bloated and slow and sluggish.
Yep.
And so you think about, oh man, you do not want a slow, sluggish immune system. This is an army, right? So it's like an army, not fat shaming here, but nobody wants an army of fat people, right? They're not going to be very good fighters. So you want them to be lean and strong and healthy. And so, again, this is one of the ways that obesity contributes to cancer. Like I said, it's the number 2 cause, is this immunosuppression.
Correct. Yeah, and that's, I wish I could say, hey, do these mistletoe injections and your immune system will be 1,000% but that's usually one of my therapies that I really is a go-to for getting the immune system going, but there's so many other pieces. Like you said, it doesn't replace exercise and weight management and eating a healthy diet, but it does give the immune system that nudge to get moving in the right direction. And particularly during and in that 6 to 12 months after any sort of chemo, mistletoe is huge. It's a must, in my opinion. And I think we're seeing now, you talked about some of the IV vitamin C research, but there's some exciting trials with mistletoe going on at Johns Hopkins right now. And I think we're just maybe a year or two away from this thing really getting some momentum behind it.
My friend Eva-Lise Page, who you also know, is largely responsible for these mistletoe trials. She's a stage 4 colon cancer survivor. Mistletoe was a big part of her therapy and the reason that she believes that she is alive today. And she has spent, I don't know how many years now, but many years, 5 years, 8 years. She created an organization called Believe Big. They've been fundraising to fund clinical trials on mistletoe. Now those trials are getting going. Yeah, it's exciting.
Yeah, so, it's while we're doing, doctors like me and clinicians that have been doing this for years, it's like, okay, we're finally going to kind of get that science done. And this is the way natural medicine always works, right? There's like this long period of clinical experience with medicines, and then it's almost like backwards of the way they do like drug development, where they start in the lab and then move towards clinical use.
To see if it works in people.
Natural medicine, we start with the clinical use and we realize it's safe and people get experience using it, and then we go back and we kind of fill in all the scientific gaps.
Right. Well, that's like the history of natural medicine since Hippocrates, right?
Right.
Hippocrates and everyone since has known that nutrition and certain natural compounds and things are beneficial, but
right.
Not known exactly why or how, but they just knew they are. And so, science is catching up to the real world experience of, practitioners.
Yeah, and the science is nice, and it's always great to understand on a cellular or biochemical level what's going on in the body, but it's almost like from the mainstream side, it's like unless there's a randomized controlled trial, showing that, green leafy vegetables are beneficial or exercise is helpful, we won't put our stamp on that yet.
Yeah.
So that's frustrating sometimes, but nonetheless, the studies are happening and we're moving forward, we're persevering. So mistletoe is a great therapy. We do a lot of other things here at the Reardon Clinic. Of course, we're always trying to, like you said earlier, we're always trying to find those root causes and address those. But other sort of more direct therapies that we do here, things like ozone.
Why ozone?
Ozone, I like Dr. Frank Schallenberger's take on it. Anytime you have disease, you have a lack of oxygen. Okay? Ozone is a super oxygenator. It oxygenates tissues. If you can get it into the right tissue where there's a lack of oxygen, you can change that whole landscape.
Ozone is 3 oxygen molecules bound together. O3, right?
Exactly. And so along with that oxygenation factor, it also kills a bunch of stuff. It also kills a bunch of pathogens. They use it to sterilize equipment, and a lot of dentists use it during their procedures. And so oftentimes if we find cancer patients that have an underlying stealth infection like Lyme or chronic EBV or mold or something like that, the ozone's a great complement to whatever other treatments they're doing, because you're almost getting this sterilizing or purifying effect of any pathogen as well.
I'm glad you brought that up, because chronic infections, like you mentioned, bacterial, viral, parasitic, also suppress the immune system, right?
It all comes back to the immune system.
It all comes back. And so, sometimes, the only way to fix the problem is to kill off a viral infection, to get that under control. Now, how do you administer ozone?
We administer ozone pretty much every way it can be. There's lots of applications for ozone. There's injections into joints or small spaces. A lot of people are familiar with major auto hemotherapy, which is basically diluting the patient's own blood with ozone in a saline bag and then delivering that back into the patient. I don't like to, use the analogy of a vaccine, but you can kind of think of it that same way, where you're exposing some of the patient's blood to ozone in this confined environment, which has kind of an effect, but then the results of that effect are being sent back as a signal into the body. And so whether that inoculates kind of the immune system a little bit, or you get oxygen obviously in through there as well, the blood is further oxygenated, but there's a multitude of effects that happen, and it's very safe, and it's another great adjunct that can be added to most other therapies that patients are going through.
Do you do ozone saunas?
We advocate for them. We don't have them on site, but I'm a big fan of sauna in general, and if you can add ozone into the sauna, why not? Because sauna or any sort of hyperthermia is going to also increase circulation. It's going to open things up. It's going to put pressure on cancer cells. And then if you're able to get ozone in through that same process, it's almost like this entourage effect.
Yeah, that makes sense. What other therapies do you like and see benefit in?
Well, another area that I've kind of gotten into is this idea of sort of a metabolic approach to cancer. And there's lots of pieces to that, but a piece that maybe we could talk about would be these repurposed drugs that, there's a book called How to Starve Cancer, Jane McClelland. You probably have interviewed
Yeah, I've interviewed her. Yep.
And it's not always with medications, but utilizing certain herbs or drugs that can block metabolic pathways by which cancer cells used to grow. And so I've kind of adopted a strategy of utilizing certain off-label drugs with certain tumor types. I definitely go by the sort of what matches up. It's very individualized. But I've seen a lot of my patients that really have just gotten over a hump by adding that piece into their overall treatment plan. And also I've had patients that, have not had a lot of side effects from those drugs. I think there's an artful way to do it and a safe way to do it. You got to be mindful of drug interactions and things like that. But that's another piece that really excites me. And I think there's way more to learn in that role as well.
Yeah. So which drugs? Metformin, lovastatin?
Yeah, again, it really depends on the tumor type.
Okay.
There's sort of like a base package of 4 drugs with metformin, a statin medication, doxycycline, and mebendazole, which is an antiparasitic.
Right.
And there's a outfit called COC, or Care Oncology, that sort of has some research around that 4-drug protocol. But the list, you've talked to Jenny, so the list for potential repurposed drugs or nutrients is 20, 30 long.
Yeah, dozens. There's dozens of drugs. There could probably hundreds.
Right.
Just, I know there's an effort to now go back and revisit every drug ever,
right,
and see if they have some kind of anti-cancer mechanism, and how that would fit into a puzzle. It is challenging with drug research because you got drug interactions, you got access to drugs is a challenge. You have doctors have to be on board to be able to prescribe them in the right doses, and it's a very complicated approach. But I'm when you compare that to the standard of care now, which is chemotherapy, the risks are, an order of magnitude lower, at
Yeah.
least,
Yeah.
in terms of risk of death or serious side effects and immune system destruction and things like that. So I interviewed Jane because I thought, I've been following this for years, actually, for her and that research, and was very leery of it because I'm like, pharmaceuticals, I don't know if I want to get tangled up in this, in the pharmaceutical world, but I think there's some value to it, and there's definitely some wonderful testimonials, including Jane's, of folks that have been able to get their cancers under control and get into remission and carry on.
Yeah. Yeah. It's still a lot to learn, but I'm learning, new tricks and new hacks every day with my patients. And luckily for me, a lot of my patients come to me and they're willing to try these things. They're willing to kind of think outside the box. And
it's low risk, which is
and
nice.
It's low risk. I'm not a big risk taker, obviously, when it comes to my patients and their health. The last thing I want to do is add more insult to their system. But when you start, when you go back and you read, about Warburg effect, and you read about these underlying sort of cellular machinery issues, and whether it's an herb or a nutrient or a drug, to me, it doesn't matter. It's all about, is this going to put pressure on your cancer cells so that whatever else we're doing is going to make them more susceptible and weaker?
Yeah. Makes sense.
Yeah.
So we've got a few more minutes here. Would love to know, when I'd love to know what you tell a cancer patient, maybe what you tell every cancer patient right up front. What are the most important things they need to know, assuming they don't know anything?
Yeah. And, a lot of my patients are already well read and well researched and know a lot about this, but some of them are, very much just sort of deer in the headlights. For me, it's all about the relationship and making a connection with my patients. I hope that my patients look at me as kind of someone they can trust that doesn't really have any skin in the game or any bias towards natural medicine versus conventional medicine versus whatever. I've seen both sides, okay, and I realize that there's benefits on both sides, and so I think that approach just really comforts patients, that they know that I know what their oncologist is doing, I know what I'm doing, I know how they work together. And so that gives them a lot of trust and confidence in me, hopefully. And I also tell them that, my ultimate goal is to get to where your body can take care of itself again. Just because you have cancer does not mean that you can't get back to that point where your body can take care of itself again. I mean, you're a shining example, obviously. And I've had lots of patients that have had those results as well. And so it's just about instilling hope. They just patients don't get enough hope. And it's not false hope, it's just, hey, look, we're going to put together a plan. We're going to learn as much as we can about your cancer. We're going to do whatever tests need to be done. And we're going to get a game plan together. And at the end of the day, we're going to, we'll give it our best shot and see where it goes. And I think patients just really enjoy just having that transparent, because they don't get that transparency on the other side.
No, they don't. Most patients, unfortunately, just feel like, a head and a giant herd of cattle. It's, and it is. I mean, you go in the clinics, there's just hundreds and hundreds of people coming in and out every day, and it's just, it's, as my friend Dr. Pam Weibel says, it's, well, I'll paraphrase her, but it's conveyor belt medicine, that's what it is. And it's hard to get individualized care And my sympathy is for the doctors as well, because they're trapped in a very difficult system. I mean, it really stinks to be a doctor working for a giant, corporation, medical corporation, because they only have a few minutes with each patient. They're working super long hours. There's tons of stress. There's tons of liability. It's just they don't have the freedom to do what you do.
Right.
And what Dr. Ron does, and so many other integrative doctors are able to do. And I would just want to applaud you. Thank you for, stepping out, for being courageous and really caring about do no harm medicine, which there are not enough doctors that, do, but it's growing. That's good. And for taking the time to really, get down and dirty with your patients and understand their health challenges, the root causes, and walk them through that. That means a lot to me. As a former patient, I had some practitioners and a medical doctor that cared about me in that way, and it meant a lot to me. So it's been a thrill to do this interview. Thank you so much for your time.
Thank you, Chris. Yeah.
Where can people find you?
So, yeah, I mean, I full-time practice at the Reardon Clinic, reardonclinic.org.
That's RIORDAN. Yeah, RIORDAN, clinic.org.
Yeah, so you can find me and all that I do and all that we do at the Reardon Clinic on our website. And we also have a YouTube channel, so lots of presentations and educational materials on our YouTube channel as well.
That's good. We'll link to those things in the show notes for everybody watching on YouTube or listening to the podcast. Just click through the show notes for links to Dr. Tim's. Now, there's multiple Reardon locations. There's Wichita, your Kansas City, and there's a third one?
Yeah, out in Hayes, in the western part of Kansas.
Okay.
Dr. Dustin Moffitt, he runs that clinic out there for us. And so, yeah, we've kind of franchised.
There we go. Midwesterners.
Yeah,
you got some options.
We're looking to continue the Midwest domination. So,
well, bring one down to Memphis, man. It's a black hole down here.
We talked about Memphis. I love Memphis. I'd love to come back there. So, the other spot to maybe catch me at is on Instagram at Dr. Lucas.
Cool. We'll link to it for sure. Thank you so much, Dr. Lucas Timms. It's been a pleasure. Thanks for watching, Chris. Everybody. Please share this interview with people you care about. Repost it on Facebook, social media, wherever. People need to understand that they have more options than they realize, that there's a whole world of nutrition and holistic medicine, natural, non-toxic, do no harm treatments out there that are powerful. And we just need to spread the word. I need your help. We need your help spreading the word so that the world knows they have options. So again, thanks for watching, everybody. Thank you again, Dr. Timms. We'll see you on the next one.